This video will cover the topic of sensory and perception. We will explore various aspects of sensory perception disorders and related care. Upon completion of this module, you will be able to identify the prevalence, risk factors, and clinical course of clients with peripheral neuropathy. We will also discuss assessment, diagnostic tests, care planning, management, and safety goals for these clients. Peripheral neuropathy involves vascular changes that affect arteries or veins, leading to insufficient oxygenated blood in the legs and feet. This can cause cold feet, numbness, and cramping pain known as intermittent claudication. Peripheral neuropathy occurs when trauma or a disease process interferes with peripheral nerves. This decreases the effectiveness of blood vessels, causing superficial vessels to constrict and divert blood. Consequently, peripheral nerve endings suffer from decreased blood flow, leading to neuropathy. The pathophysiology involves the peripheral nervous system linked to the CNS, affecting the axon and myelin. Polyneuropathies are bilateral sensory disorders, often associated with diabetes. Mononeuropathies affect a single nerve, usually from injury, trauma, or repetitive motions. Risk factors for peripheral neuropathy include diabetes, alcohol abuse, vitamin deficiencies, particularly B vitamins, immune system suppression, autoimmune diseases, kidney, liver, and thyroid disorders, exposure to toxins, and age. Prevention strategies include controlling medical conditions, maintaining a healthy diet with vegetables, fruits, and whole grains, and ensuring adequate intake of vitamin B12. It is also important to avoid triggers, such as repetitive motions, smoking, toxic chemicals, and cramped positions. Clinical manifestations depend on the affected nerves and the extent of damage. Common symptoms include a distal paresthesia, and for conditions like GBS, a stocking glove pattern. Patients may also experience weakness in the arms or legs and pain. Sensory nerve damage can present as unusual sensations, pain from light touch, burning, numbness, and tingling. Motor nerve damage may manifest as muscle cramping, twitching, balance problems, and reflex abnormality. Diagnostic testing includes electromyography, or EMG, and nerve conduction study, or NCV. Other tests include monitoring glucose and A1C levels, serum levels for B vitamins, thyroid function tests, liver and kidney function tests, and rarely, a nerve biopsy. Here are some images of nerve conduction studies, which are used to evaluate sensory perception disorders. This image also illustrates part of the diagnostic process. There is no specific treatment or catch-all drug to treat pain for peripheral neuropathy. Commonly used medications include anticonvulsants, antidepressants, topical agents like the lidocaine patch, and various pain relievers. Surgical intervention may be appropriate for peripheral neuropathies caused by compression, such as nerve tumors or carpal tunnel syndrome. Non-pharmacological therapy focuses on managing the underlying cause and incorporating lifestyle changes. These include physical and occupational therapy, compliance with therapeutic regimen, a healthy diet, maintaining optimal weight, regular exercise, smoking cessation, and daily foot care. Complementary and alternative therapies can also be beneficial. These include acupuncture, transcutaneous electrical nerve stimulation, or TENS, and massage to help manage symptoms. Nursing assessment involves collecting a thorough history, including details on sensory impairments, comorbidities, and the location, intensity, and exacerbating factors of symptoms. A physical assessment includes cranial nerve, sensory, and motor function evaluations. Potential nursing diagnoses include risk for injury, ineffective peripheral tissue perfusion, pain, and anxiety. Goals focus on the client remaining free from injury, reporting effective pain management, and verbalizing feelings and concerns related to sensory loss. Key interventions include injury prevention, as those with compromised feeling may be unaware of injury. Include the client and family in decision-making, and teach them preventative and comfort measures. Teaching topics should include foot care, exercise, nutrition, smoking cessation, and massage to improve circulation. Nursing care also focuses on promoting comfort by listening to pain descriptions, using a pain scale, employing complementary therapies, and providing scheduled analgesics. Expected outcomes include pain control and reduced injury risk. Let's now shift our focus to pharmacology related to sensory perception disorders. We will specifically look at the drug gabapentin, an anticonvulsant often used for neuropathic pain. This image provides a general overview of the mechanism of action, therapeutic effects, and nursing considerations for gabapentin. It's a key medication in managing neuropathic pain. Contraindications include hypersensitivity, Precautions involve pregnancy, breastfeeding, children under 3, the geriatric population, renal disease, hemodialysis, suicidal thoughts, and depression. Adverse effects can impact various systems, including the CNS, CV, GI, and respiratory systems.